doctor. He's been bleeding so much today.
Okay, got a little bit of a weak pulse. Do you have the blood pressure?
85 over 52.
I'm going to take a look at your records from the previous visit. I'll be right back.
Okay.
This is Frank Matto. Okay. So we just selected, and now we're on the cover sheet, which gives us the fact that he's had diverticulosis. That may be where he's bleeding again. So the other data is to look for what happened to him in his lab work.
Can we check his hematocrit baseline?
We can go over to his laboratory, and I always like to use the worksheet because that gives me a long view of the whole problem. You can see back in 1993 he had a very, very bad episode. Now, along with the bad episode, we noticed that in 1993 there are some pieces of information over here. His colonoscopy, and we're looking right in there. There are his diverticuli.
Sure.
And over here we're seeing a lot of blood coming down the colon. This man is in major trouble. And over here there is a film taken at that time. Notice that film is an arteriogram, and we can make that larger. You can look around. I see something up in this mag view here, but I think I probably need to change the leveling. Notice there's a little bit of bleeding probably way out here in the colon, consistent with his diverticulosis. And I think that may well be what's going on now. I think probably the best thing for you to do is order a nuclear scan, since he is actively bleeding. We can take advantage of that now. Radiology orders, select nuclear medicine, and then many of the nuclear medicine studies are already listed ahead. We'll go down to gastrointestinal, and notice that there is a gastrointestinal bleeding study. Back and take care of the patient.
Okay, great.
Hold perfectly still. Can't bump anything here. Okay, I'm going to get this over the area of your heart. That one. We're starting right now, sir. This will take about 20 minutes. Make sure do not move.
Hey, Elliot.
Yeah, how you doing?
Good. Is this the GI bleeder that's in the emergency room?
This is. There's blood all across the proximal colon. So indeed, this is positive. The patient is actively bleeding, and our best bet, looking at the early images and the cine images, is it looks as though it's in the proximal to mid-transverse colon.
Great. Thanks, Elliot. I'll get the GI fellows to scope.
This patient apparently bled about 5 years ago.
Some more pressure here.
Let's take a look and see what we can figure out. I guess at this point we're looking for things like diverticuli, mass lesions, arterial venous malformations, although my understanding was that his previous studies really didn't show very much, so it's unlikely that in those years it would be a malignancy at this point. Okay, Dr. Caillou, capture that image. It looks like we've got active bleeding going on here in the lower colon. Why don't you just freeze that?
Okay, got it.
Okay, I think that'll prove useful. That looks pretty good. There's some blood in the field right there. You agree?
And clot.
We endoscoped him this morning, and he has a little bit of blood, actually a fair amount of blood, probably somewhere in the descending transverse colon with these diverticuli, and we're trying to figure out whether we should do an angiogram. So I thought I'd, see what you thought about it.
Well, you've given me the facts that this is the second episode of his lower GI bleed, looking from the same site. I would consider the possibility of angiogram, but perhaps even surgery as a first option.
Well, he's doing much better. He did have chest pain when he first came in, but as you can see from the electrocardiogram that we've now gotten, it is quite similar to his previous tracings. We also see his old colonoscopy, and you can see that he did have quite a bit of bleeding and had a marked hematocrit drop in 1993, which seems to be the same now. He's dropping at this point as low as 25.
Dr. Siegel, were you able to take a look at the angiogram?
I was. As you can see, we've performed a selective SMA injection. I think we can probably best see it on the cine loop images on the VistaRad system. And when I cine the images, you can actually see the area of contrast extravasation blinking on and off, and you can see the entire run. So the study is positive for mid-transverse colon